The Cochlear Implant program in Victoria has a long history. It was established back in 1985, I believe, as the first international cochlear implant program to support the provision of implants to Victorians after the successful establishment of the implant through the University of Melbourne. It has expanded since that time as the volume of implants has increased, and has expanded both in the number of clinicians, both audiologists, speech pathologists and surgeons. And we're pleased to remain one of the leading international programs, and the Melbourne program has led the way both in research, in the demonstration of the effectiveness of cochlear implants and the provision of services to Victorians. And our model has been emulated around the world. It's been wonderful to see how the number of recipients for cochlear implants has increased over the years. When I started back in '93, I believe, as a consultant, we did approximately 50 implants a year, and that's gone up to over 350 now. And we hope that that will continue to expand. The Victorian Cochlear Implant Expansion Project, which we are now involved with, we hope will make it much easier for rural Victorians to access cochlear implantation and limit the amount of travel involved. And so progressively the numbers would further increase and the access improve. In terms of future developments for the Victorian Cochlear Implant Program, we look forward to a structural redevelopment of the clinic itself. The Ionia Hospital has been redeveloped, and we look forward to a further structural redevelopment of the clinic. And this will then help to be a central hub for the expanded cochlear implant program throughout Victoria. Cochlear implants are indicated and are very effective for the majority of adults or children who have a sensory neural hearing loss and aren't able to get benefit with hearing aids, conventional hearing aids. And so for someone who's struggling with their hearing and can't use a standard hearing aid with benefit, then the next step is to be assessed and have the level of hearing and speech understanding measured, so we can then predict whether or not a cochlear implant will provide better hearing than what they can achieve with a hearing aid. And so that assessment needs to be done by audiologists, either in our clinic itself or throughout the clinics or throughout clinics around Victoria. And then our expanded implant program will hopefully allow easy communication with the clinic to facilitate access.